This podcast is sponsored by Orchid Live. Orchid Live is a specialist occupational health software used by a number of SOM members to run every aspect of their occupational health operations. They hold healthcare records for over 1 million UK workers and work with both in-house OH teams and OH providers. You can find out more at orchidlive.com.
Hello and welcome to the latest episode of the Global CMO Podcast. I'm Dr Lara Shemtob, GP and occupational health physician, and I'm here with Dr Katherine Carandang Chua, who is Chief Medical Officer at biopharmaceuticals company Pfizer, and Katherine heads up the APAC region. Welcome, Katherine. Tell us a little bit about yourself.
Hi, Lara. Nice talking to you now. A bit about myself. All right, just like you, I'm an occupational health physician, occupational medicine specialist. I am looking over the APAC region for Pfizer. All the markets we're in, we have presence here, manufacturing, commercial, our R&D sites. I try our best to take care of our colleagues working on those sites. I've been practicing occupational medicine for almost 17 years now.
I'd love to hear a little bit more about the remit of your Chief Medical Officer function at Pfizer in the APAC region.
So the title is to be technical director of occupational health and safety. So I lead a team of occupational health physicians, nurses, as well as there are psychologists and therapists in our team across the Asia Pacific region. We have several clinics across India, Japan, Australia, China, here in the Philippines, Indonesia, Korea as well. Even in those sites that we don't have on-site personnel, definitely we try our best to cater to their needs, especially now that the company has been given so much importance with occupational health and, the different work-related conditions that our colleagues have been experiencing, especially post-COVID. So many things have opened our eyes with issues that we have to pay attention to, especially in the workplace. I work closely with the EHS team, but here at Pfizer, occupational health, or we call ourselves colleague wellness, because definitely we try to address the whole health thing as holistically. And not just not just like the physical health. Emotional health is very important, as well as spiritual health, to help our colleagues to be able to have a holistic, healthy working life as much as possible.
Yes, that's very interesting. And particularly because, of course, you're working and leading across a very large and very diverse region. What does holistic worker health mean in different parts of APAC? And how do you, your team and the organization manage to deliver consistency, or perhaps delivering things a bit differently?
Every day is a learning process, definitely. But one thing that I am proud of is that the management recognized is that different parts of the world have different cultures that affects the health and working environment. For us to be able to cater tailor-made programs, health programs, nutrition programs that are suited for the colleagues that we have in the different places. So that's one thing I'm very proud of. We continue to learn, and the management is very much open into the ideas that we feed back. Let's say one good example would be we try to improve our nutrition education because, again, as with prevention is still best. So we try our best to provide educational materials, tools through apps that are adapted to the region. Like we have recipes coming from the different countries, from Asia, from Europe, from the US, from Latin America, especially like US-based organization like us. People would expect that it's US focused, but we are trying our best now to also give importance to our colleagues outside of the US.
I love that example for a couple of reasons. Firstly, because it shows that you are trying to deliver consistent prevention and meaningful support for your health of your workforce, but not in a one size fits all approach. So that demonstrates that really well. But secondly, just the degree of kind of prevention that falls into your remit, looking after your workforce in your occupational health role, is really interesting. We're really talking about starting with, we think about the biopsychosocial, like food probably fits a little bit more into that social domain. So that's a great example of starting from the ground up and making sure your workforce has what it needs, not just dealing with problems as they arise down the line when people have metabolic health issues. You mentioned that the COVID-19 pandemic changed how things work for your team. So is there anything in particular that changed, or that you do things differently now than you did then?
Oh, lots of changes. COVID was an opportunity for our team. So we became one whole department. Before, we used to be incorporated or integrated with the EHS team. We're able to roll programs easily because we all understand what is the logic, what is the need of doing those programs for our colleagues. It's easier working with professionals that have the same expertise, more or less the same issues. We're now able to communicate and coordinate faster because we are now in one whole umbrella. Before COVID-19, of course, the company is very focused also with employee health, with occupational health, but more so after COVID-19, I think.
You've spoken a lot about how employee health and holistic well-being is a real priority. What does that actually mean to your organization in terms of defining workforce health as a business asset?
Well, they recognize the fact that if there are no people, there won't be any business. Yes, it is a business, but people are very important. Going back to the pandemic, they were able to recognize the importance of mental health, especially at that time, early at that time. I think we were one of the early adapters of offering employee assistance services worldwide, not just in the US. So this was like quickly offered. Apart from that, physical health was considered, that we quickly had those apps available to employees, making sure that everyone gets it the best way through mobile, through their laptops. It's not a perfect program, but as much as possible, the company has made very big investments to ensure that all our employees worldwide are given the same services in terms of occupational health, and not just what our colleagues are receiving in the US, but outside the US. Definitely we try to give them almost, or if not almost, the same services as what they are having in the US as well.
Yes, and that's challenging, kind of as we discussed, in terms of how people feel and behave around health in different parts of the world. It's interesting that you mentioned technology, because I'm interested in hearing about how digital health and maybe even AI and analytics are transforming the way you manage workforce health.
It's something that's very new, but something that we are embracing right now. Definitely using AI to help enhance our services is something that we are learning every day. Well, one thing, we have improved our EAP, our employee assistance services. We have incorporated AI also as well to help people, not just those people who think that don't need help. Sometimes we're like, oh, I'm okay. Like, I don't need that. But we have incorporated that in our services, wherein we're able to do check-ins with all our employees and make sure they're okay and ask them questions, just to give them also a push, like, hey, maybe you think you're okay, but you're not. But we have those services for you. So we have incorporated that in our services. Of course, the analytics, definitely, that is something that is a priority for us, given that we have a large team worldwide. We don't just want to do programs just for the heck of doing health programs. So we now, our focus is to have data driven health programs, not just because that's the trend, or that's what is popular, or being done in other companies, because definitely we want to be in the forefront of improving occupational health services for our employees.
Yes, that example of using AI support in EAP to catch people, even at a point where they may not yet have the insight that they're feeling unwell, is a great one, because that kind of links again to the idea of prevention and isn't something that would be probably feasible or scalable without AI support to kind of reach every employee for check-ins. I mean, the flip side, of course, is the way AI is changing the workforce and how people relate and to work and how people work generally. And I wonder if you've seen in your leadership position examples of the workforce having challenges adapting to AI, or maybe even advantages of working with AI and some health issues improving as a result.
Well, first, I think the challenge is there is that fear of change, right? I think that's normal. And I've been, of course, hearing that a lot. Like, would AI replace me? Is AI going to change everything in terms of how we do work? So, will I still have a job in a year or two because of AI? Those are the normal challenges that we face with any change or any technological change, not just AI. But I think it's about educating our people, teaching them the skill to be able to adapt and use AI to their advantage. And definitely we are doing that a lot. That is our focus this year and the coming years. In terms of like how better it is, definitely it has made things easier in terms of improving communication. Not everyone is, that articulate when it comes to speaking English or writing emails in English, but AI has definitely helped with that. And I think that is a very good change because you're able to verbalize clearly what you want to express. My team in Japan, that's one good example. They love using AI how they write because it has helped them immensely. How they participate in meetings, how they are able to make presentations, that helped them a lot, I think. And they continue to be like every day, they are so thankful that we were able to provide them that resource of using AI with their reports as well in their documents. In the future, I mean, the possibilities are so many. I'm not an expert, not much of a techie, but I try my best to adapt as much as possible. I try to educate myself, definitely using it on a daily basis, using it to an advantage to be able to improve the processes that we have, the administrative stuff. Of course, with medicine, I don't think, the person or the people factor at this point, I don't think it will still be replaced yet. I don't know in the future. But definitely in the other areas of our work, it's highly valuable to learn how to incorporate using AI.
Yes, those are fascinating examples. And it does sound to me that Pfizer really recognizes the role of occupational health in supporting the organization transition to using AI. Because, as you said, change is huge. And we know that change is one of the biggest risk factors for work related stress. So it certainly sounds like your team has really been across that in helping the organization adapt to the way things are changing. And I suppose the other thing that you mentioned is really interesting on holding in mind kind of global workforce, because again, communication issues can, firstly, I can't imagine what it's like trying to communicate to people in different languages and the sort of the hidden workload that comes with that. And again, demand, of course, is a risk factor for work-related stress. And then secondly, communication issues can lead to relationship breakdown, another
Definitely.
aspect of work-related stress. So you've really illustrated so well how relevant occupational health is to getting these changes right. And it's great to hear actually that Pfizer's kind of recognizing that and rolling with it.
Yes, hopefully we're doing it right. Hopefully we're in the right path.
Do you have any examples of how you measure the business impact of workforce health, or where you find that better workforce health has improved business outcomes tangibly?
My mentor, my boss, Dr. Nikki Schaefer, has always emphasized how that in our work, in the colleague wellness team, we measure our success in the lives touch, not in the number of patients. Because again, you help someone, you help one worker, one colleague who has health issues. You're not just helping that person. You're helping the family he or she supports. You help, the community where he is a part of. So I think that's, one good way to look at how we make an impact, because we're there in the forefront. We get to meet our patients in the workplace. We get to see them before their health issues get worse, or even before they need to be hospitalized or even see a specialist. If were able to help them early on, we're not just helping them, we're helping the people around them, we're helping the people that they help.
Yeah, you're right. There's something really holistic about working in occupational medicine. It truly is a kind of biopsychosocial space, which is quite rare to really get that full spectrum in other medical specialties. So that's also something I really love about the work. And it's also that thing you said around, measuring impact through lives touched is also, of course, really relevant to the organization, because we know that, for example, if somebody becomes unwell and then there is pressure on their household or there's financial pressure on them, that whole kind of global holistic view does, of course, feed back into their work performance. So being so discreet about how we measure our impact may not always reflect the whole tangible and intangible aspects of the benefits. So if there was one thing business leaders could do tomorrow to make work healthier and more productive, what would that be?
Oh, tough. But I think the most important thing is they have to talk the talk and walk the walk. It's very important that they have a policy in place. And I still see a lot of companies don't have the commitment or the policies for occupational health. So I think that's one very important thing that companies should be able to do in this day for them to move forward and make sure that their workforce are healthy. If the people that are working for you are not able to do their job well because they're unhealthy, you won't be able to have a successful company or a successful product. At the end of the day, people are still the most important resource that a company can have.
And those 2 points sort of lean on each other quite well, sort of recognizing the importance of workforce health and then following it up with some concrete policies, some real clarity and directions for support. Those really are the fundamentals, aren't they? Those are the foundations that if all employers were engaged with, it would make a huge difference for the health of the workforce and also for their productivity.
Yes, definitely. Hopefully, we see a future wherein, everyone will be able to do that for their employees and their workers. Some people see us as an expense, but I think they should see us more as an investment. If they invest in us, they're investing in their people.
Totally. And yes, our conversation today, I really think, thank you for sort of helping us move that narrative, because you've given so many examples of exactly how that can work. So yeah, that brings us to the end of our time, but so grateful to be able to speak, and thank you so much for all of the points you've shared.
Thank you so much, Lara. It was a pleasure talking to you.
This podcast is sponsored by Orchid Live. Orchid Live is a specialist occupational health software used by a number of SOM members to run every aspect of their occupational health operations. They hold healthcare records for over 1 million UK workers and work with both in-house OH teams and OH providers. You can find out more at orchidlive.com.